Welcome to Leaving Nothing to Chance, your go-to podcast where we bring you insights from some of the most influential voices in small business and personal development. Each week, we dive deep into conversations with top thought leaders, authors, and business moguls from around the world, sharing their secrets to success and strategies for growth. Tune in for exclusive content that will inspire, motivate, and equip you to take your journey to the next level. This is Leaving Nothing to Chance.
Welcome, everybody, to our second session with Dr. Carl Rothschild. And Doctor, welcome back to the show. And I've got a few more questions for you.
I'm waiting. I just hope everybody doesn't realize that I'm wearing the same shirt.
And so am I. Yes, folks, we did do it the same day. We are cheating. But at the end of the day, these are two segments because the doctor has so much information, too, that we don't want to overwhelm you with one show and you get off and you say, that's just too much. So we figured we'd break it into two shows. So, Doc, I appreciate the time. As always, good to see you. So let's just pick up. Let's talk about wound healing and red light therapy.
So anything on the skin responds unbelievably fast. So the deeper penetrating, the deeper tissues take a little bit more work, but the skin responds incredibly well. So we had this one lady, she had third-degree burns. She was guaranteed by the wound center to have 6 months of pain, 6 months of drugs, and permanent scarring at the end. By the middle of the second week, the pain was mostly gone. And by the end of the third week, it was gone. No scarring, nothing. It looked like it never happened. And so it brings to question, why doesn't every wound center have a full body bed? And I don't have a great answer for that. I can tell you one of the most significant reasons in this country why things do go one way or another has to do with money. So if something can make you $20,000 over here and something can make you $200, which way do you think things are going to go?
Yeah.
That. And that goes to just about anything. I told you before, if you heard from the first section, that Chadwick Smith, the medical doctor, who brought this, he was the first one to get the FDA clearance and all that for red light therapy. And he couldn't get any of his fellow orthopedists or any of the doctors to join him. And that's because they wanted to do the surgery. They didn't want to not do the surgery. And red light therapy, in some cases, not every case, in some cases, will be able to heal that tissue without needing the surgery. And that drove these orthopedists nuts. On the other hand, the chiropractors went crazy for this because it's all natural. You're not putting anything in the body that doesn't belong there, or yanking anything out that does. You're not injuring, you're not damaging, you're not doing anything to any of the tissue with this glorious, essentially sunlight. So the chiropractors took to this like amazing. If you go to, when I was first introduced to this 27 years ago, if I went to a chiropractic convention, there was nothing about red light therapy. And now if I went to a chiropractic convention, there would be many booths dedicated to red light therapy. There would be lecturing about red light therapy. I do lecturing about red light therapy at several of these different events. And I'm glad to say that this was one of those things that I chose to get involved with that took off. Not everything we all do takes off. My family is famous for buying high and selling low. So
we're related.
So
should have been here last week and bought.
This was one of these glorious things where, I got on board with something that really just has taken off like unbelievably. And it's the same thing with chiropractic. When I started with chiropractic, there were two chiropractors in the same area when I opened up in West Los Angeles, California. And when I retired years later, there was probably 100 chiropractors in that same area. So chiropractic also, I started when it's in its infancy, in business. It had been around for 100 years, but was not as popular. And then starting in the late 60s, and I started in the 70s, started really to take off. So people recognizing it, celebrities got involved, Will Chamberlain, Madonna, a bunch of others started having chiropractic in their lives, and the word spread beautifully. At any rate, so Did I answer your question?
You actually answered two of my questions, which is great. So let's talk a little bit about TBIs. I know that there was a 2020 study on TBIs released down in Brazil. TBIs are something we hear about all the time with football players, hockey players, rugby players.
Everyone knows it's traumatic brain injury, and the results are incredible with the bed and with the lights. So the amazing thing is that the lights can actually, see, people wonder, can it penetrate your skin? They realize, yes, it can. It can also penetrate the skull and get to the brain with glorious results. And so I had one lady, she wrote me this email and said something to the effect of, if this is how normal people feel all the time, I can't believe I've been missing out. And the point that I want to indicate is that she was highly depressed. She hated her life, and now she doesn't. So it can actually make people feel better about their lives, more joyous. And I'm not making this up, so you can go on Google Scholar, as I had mentioned in the last show. Go to scholar.google.com. Put in the word either photobiomodulation or red light therapy, and then put in brain trauma or TBI, traumatic brain injury. You can put in depression, whatever, and just see how many studies there are, how many articles there are that are about red light therapy. And one of the things that you and I talked about is, why isn't it even bigger than it is? And it all comes down to money. And which direction are people going to go? If you can make more money doing this, then this is the direction people are going to go. It's not about how many people you help. It's about how much money people can make. And so when you can get surgery done that can make a doctor tens of thousands of dollars, how many of those doctors are going to say, you know what, I don't want to make that money anymore. Let's put them in a red light bed and avoid the surgery. So, yeah, I just got myself in trouble with some medical doctors, I'm sure, but I've been fighting this battle since 1978 when I first graduated and became a chiropractor. And to be honest, within that first year, I don't know if I told you this, side note here, within my first year of being in practice, a medical doctor called me up and threatened to put me in jail. I'm going to call the authorities on you if you treat my patient, he said, because his patient was pregnant and there's nothing he could do to help her with her back pain. And I had many tools to help her with her back pain. I actually had a unique table that allowed a woman for the first time in weeks to lie face down with their belly in this section of the bed and allow me to actually help her with her spine. And I was the only one to help her. Wow. And so she told the doctor to go to help. But at any rate, with that said, I've been faced with that dilemma all the time. It's about power, it's about money, sometimes it's just about knowledge. And if you're a doctor and you know nothing about red light therapy, then I think shame on you. That's crazy. You don't know about red light therapy, or your doctor doesn't know about red light therapy. What's going on here? But I can have somebody that's in a stage 4 renal failure. What do you think they're going to do? They're going to put her on dialysis, which can make somebody a lot of money. And after a month of using red light therapy, she doesn't need her kidneys are fine, 100%, came back to life. So anyhow, getting back to brain trauma, it works remarkably well for that. And it affects the brain, but it also affects all the other tissues of the nervous system as well. Now, the nervous system is a pain in the butt because if you cut yourself, the skin's going to heal. If you break something, wound something, stretch something, sprain something, strain something, it typically can heal. Nervous tissue is not great about healing. In fact, often if you cut a nerve, that's the end of the story. And that's the last thing you want to do. So recovering from nervous tissue issues takes longer. But we've had people with horrible peripheral neuropathy. So this means that when the person's lying, they can't even have a blanket over their feet, for example, because it's painful. They can't have any weight on their feet. And within a couple of weeks, or certainly within that first month, that stops. And now they're able to walk over uneven surfaces because they can't walk very comfortably because of the pain, because of the balance, bunch of other things. And so even with peripheral neuropathy, it's actually if we can get the person's diabetes under control. Now, if these people are out of control and not taking the medication that they need at that point and eating foolishly, then we're going to have a challenge. But if they're scared enough, as that's what it all comes down to. I've had people who I know that have cancer, lung cancer, and they're smoking. So that's an unusual person, right? They know what to be scared of because they've been faced with it. They've lost part of their lung, and yet they can smoke. So that's a whole nother breed of people that I can't appreciate. I'm a chicken. I don't want to wind up sickly. I don't want to wind up dying. I mean, I shouldn't say about dying because we're all, unfortunately, that's going to happen to all of us. But I want to go with what I tell my patients about aging gracefully. I want to do it as good as I possibly can.
Along that lines, Doc, another question that comes to mind. I saw something a couple of weeks ago that by 2050, and my numbers might be wrong here, but the epidemic proportions of Parkinson's. How does red light help with Parkinson's?
Unbelievable. Unbelievable. We had this one lady who, her biggest handicap from her Parkinson's, even though she had much more serious problems and symptoms, all kinds of symptoms from the Parkinson. But the thing that bothered her the most was that she couldn't go to church and hold the Bible in her hand because her tremors were so severe. 2 weeks later, after treatment, the tremors are still there, but they're so mild that she's easily able to hold the Bible. And months later, her Parkinson's is better and better, milder and milder. Is that going to completely go away? Probably not. But her quality of life is through the roof. And that same Parkinson's patient had also dementia. And so severe that the family didn't know what they were going to be able to do with her. They couldn't handle it at home anymore because she was a danger to herself and others. She was forgetting things. She was belligerent. And again, after just a short period of time using full body red light therapy, she was lucid. She's still an 85-year-old elderly person, but her quality of life improved dramatically. So we talk about nervous tissue, we talk about the brain. I don't know if I mentioned about a lady that had a stroke, and she was a mess, and she was too young. There's no good time to have a stroke, but you would think it would happen when you're older. She wasn't 60 yet, I think, and she had a stroke. And after 8 visits on a full body red light bed, all the signs of the stroke were gone, and she actually indicated that she was better than before she ever had the stroke.
Wow.
So brain and nervous tissue, which is difficult as heck to treat, actually responds reasonably well. Again, nervous tissue is tough, brain tough. We've seen beautiful results, unexpected beautiful results. And again, go to Google Scholar and look it up, check it out.
And I think, and you made this point earlier, there's no side effects to this. So somebody with any of these horrific ailments we're talking about, what do they or a family member have to lose saying, hey, at least let's try this, right? It might give you some relief. And you just used the key phrase, right? Quality of life. Nobody's going to live forever. But why be miserable if there's an option?
I talk about, do you want to be a burden on your society and your family, where you can't wipe yourself, you can't take care of yourself, you can't ambulate, you can't walk around, do anything because you're dependent on everybody. You're in a wheelchair and your functioning is basically you get out of bed, watch television all day, and there's not a lot of things happening for you. I don't want that. I got to admit something. There were times in my 47 years in practice where I would have a patient come into the office, and I didn't say it out loud, but I would think to myself, please God, don't let me wind up like that. I wanted to help that person as much as I could. I knew they didn't take care of themselves. They didn't eat right. They didn't exercise. They didn't do anything to take care of themselves. So if you're not scared enough, get scared. Go volunteer at a home for the elderly, that real elderly, and watch what these people are like, what their lives are like. And is that what you want? It's like being in jail.
Yeah.
You're going to be in jail for the rest of your life if you don't take care of yourself.
Exactly.
And that's what I would try to get my patients more scared. What can I do? I don't know what else to do. People buy and eat junk all the time. Listen, I had a patient that was from Europe and didn't change her diet at all when she came to the United States. And she put on 20 pounds. Her activities were the same, her diet was the same, but the junk that they put in our meat, for example, the hormones and other things, she gained weight. Now, what she did was she was able to find a place where she could get meat was not a shot up with crap, and she was able to lose that weight easily. What I'm saying is that now, whether you believe in Robert F. Kennedy Jr. helping us or not, but at least verbally, what he's saying is that maybe we're going to take profit as the only indication of what somebody should do in life, and maybe really feature getting people healthy and keeping them that way. So his attack is on the pharmaceutical industry, but also the food industry. And if he comes through, it's going to be tough. I've witnessed what I've had to go through. If he can come through with any change at all, it would be miraculous, because he's going up against these trillion-dollar industries that are not happy about losing a dime, never mind the kind of money that they might lose if we change our approach to food, if we change our approach to healing and well-being. We're trying to get to him to incorporate red light beds in these, especially for the vets. Now, you've got a vet who has had serious anxiety issues in his life or her life, and we've seen and witnessed very good results with them using full body red light therapy. I can't get to the medical profession has an upper hand on dealing with vets, and so they don't readily come to red light beds. But if we can get them in there, I guarantee you're going to see some beautiful results. Beautiful.
No group deserves help more than our veterans that served our country. Doc, let's talk a little bit about Trifecta and why it is the product of products in this particular market.
One, full body. So when I started in manufacturing, I was involved with lasers. I was involved with pads and panels and all that stuff, and they're nice. And at the time, we thought we had the best, right? But by accident, or let me say that COVID forced us to make a bed, because with a bed, the person can get in and out of bed themselves. You don't need staff, you don't need help. And you have to help me if I'm repeating myself within this segment and the last segment. We created the bed just as a substitute for what we had up till now, because our providers wanted less physical contact between the patient and the provider because of COVID. And once we saw the kind of changes that we had never seen before, when you bathe the entire body at the same time, that's a critical thing. We didn't realize it. We started hearing much more the phrase, "Thank you for giving me my life back." We heard that occasionally before, but now we're hearing it regularly. Thank you for making these changes in my life. I had one lady that said, "It changed my life and it saved my life." All in that same kind of "thank you for giving my life back" kind of phrase. And so we knew that the bed was phenomenal. And then what you want to look for are a few things. One, people think it's about power. I need a more powerful bed. And yes, power is an important thing, but it's not the end all and be all, because even 27 years ago, we could have created an unbelievably powerful piece of technology, but we didn't have the science yet on being able to produce something that's very powerful, but doesn't get hot. That's a trick. That's where the money is. That's what makes it unique. If you have equipment out there, like things that come from China, they get hot. And that's because they're using inferior equipment. You want a lot of power without heat. Heat is the enemy. Heat dilates blood vessels, brings more fluid to the surface of the body, and that would block the penetration. It's exactly what you don't want. So when you hear about infrared saunas, and by the way, that's a different type of infrared, not the kind that we use. That's far infrared, and it's great for heat, and fine. I don't have any objection to it. But you're not going to get these long-term changes to the mitochondria of the body, to the ATP production, and all this glorious healing and energy that you would get with a bed that doesn't get hot, but has a lot of power. So it's not just about power. It's about power without heat. Another factor is you want the top canopy coming down right onto the person's body, because the distance from the power, from the actual light to the body, the more distance, you lose power exponentially. You want the lights as close to the body as possible. And that's what we've been working on. A lot of power without heat, ability to bring the lights very close to the body because our lights don't get hot, but are very powerful. But also we can customize the power so that a person who is, let's say, 80 pounds doesn't get the same dose of somebody who's 400 pounds. So the 400-pounder can absorb a lot more of this power without getting hot. We're going to tone down the power for the 80-pounder because they don't have as much flesh and they can't absorb as much of this energy. Does that make sense?
It certainly does. Certainly does. And they can find out all about this at trifectalight.com. I know that's where they go for that. And then I guess my last two questions for you is, one, tell them about your book and where they can get that.
Okay, so the book is called Illuminated Healing. It's on Amazon. So you put in Illuminated Healing and you'll find it in three forms. There's the book, there's the Kindle version, so you can read it on the computer, and then there's Audible if you want to listen to something like 8 hours of me talking. But I think it's very informative. I'm not a great writer, I'm a good writer, but I gave it to the editor and wow, they made it beautiful, absolutely beautiful. So the information is there and it actually reads very well because of their capability of bringing it a better read than what I've written originally. So the book is great. I don't make a dime off of it. Just go to Amazon and you're more than welcome to get that book. I think you'll love it. So you got the book, you got our website, which is trifectalight.com. If you're interested in learning about buying the bed, there's a section there. And just remember to say that you heard about it from this show so that we can actually get you an actual discount on buying. There are two kinds of people that want to buy a bed. One person that has more wealth than health. They recognize people don't understand how much it costs to be sick. They don't get it. If you're not sick, you maybe not have experienced what it costs to be ill. Never mind all the hours of work that you lose. Never mind all the hours of pleasure that you lose, not being able to play with your grandchildren or children or whatever. But also the expense is astronomical. It will blow you away. Where a 1 hour drip of a certain drug that's a biologic is going to be billed to the insurance $55,000.
Wow.
Of which they're going to pay not the full amount, and your copay could be quite significant. Where the drops in the eye, that just the copay is $400 a month. And then if you're using red light therapy, I'm not swearing to this, I'm not guaranteeing it, but give it a try. 6 visits, just to see if it makes any change at all. You might need 20 visits, I don't know. But see what 6 visits can change in your life. So we didn't talk about the eye, I don't believe. But the person, often they'll say, should I wear goggles? I'm worried about radiation. This is not radiation, this is a light. It's the same light that you walk into a room that has the lights that are the same potential of damage. There has never been a recorded side effect from the use of this light energy and 50 years of studying it. And the worst that'll happen with anybody is nothing. So you give it 6 visit chance. Go to the website and you can find the location that's closest to you. You just put in your information. One of our staff will get back to you as to what office is most suitable for you and closest to you. And so, as you can tell, I'm crazy about this stuff. So I apologize. People might think it's like snake oil because it affects so many different tissues in your body. But when you learn the fact that it has to do with the mitochondria of every cell in your body, so every cell can be affected. That we're talking about nervous tissue and bone tissue and muscles and every organ, gland, brain, all of it. So when someone gets into bed, they don't wear the goggles. They just keep their eyes closed. And if you go to Google Scholar, you'll learn that it can help a lot of different things in the eye, including we had one lady that had uveitis. That's a swelling. Now, normally the pressure in the eye is somewhere around 10, and hers was 180. So she had to take the drops, which was $400 a month copay. And she had once a month get an injection in that eye, right into her eye, which I asked her, well, what was that like? She
Horrible.
explained how horrible that was. And she doesn't need that anymore.
Wow.
I asked her, what is the pressure now in her eye? And she said, normal.
Great.
Normal.
So, Doc, in wrapping up, you've been a chiropractor since the 70s. You've been involved with Red Light for 27 years. You've really been on two things that started out like everything as almost black magic, if you will, that all of a sudden have become contemporary and very accepted and very acceptable to everybody, both the allopathic side of the medical world as well as the people like myself and yourself that believe more in, hey, if there's a natural way to do it, let's do it. And if we have to use the allopathic, let's do it as a last resort.
Absolutely, absolutely.
But what would you say, what revelations have you had in all of those years in terms of seeing maybe people's difference of opinions than they had at one time, that they held as a certain way, or as these modalities, and there's other things we haven't discussed, obviously, that have become very popular as well. I'm a cold water therapy guy. I'm in the cold every single day, a la Wim Hof. I didn't learn it from him. I actually fell in the pool one day and felt great. And one thing led to another. And then I found out who Wim Hof was. And that's been a whole revolution, if you will, for people. And there's other things certainly we could talk about. Time doesn't allow for today. But what's been your greatest revelations over all of those years and seeing how people's thinking has maybe evolved to be more open to red light therapy, chiropractic, and other modalities?
I think people are scared and sick of being lied to. You know that right now, and this has been going on for more than a decade, someone gave permission that the pharmaceutical industry could advertise directly for prescription drugs directly to the individuals. So now you're watching television and you're watching a commercial that's telling you what you need to tell your doctor, because they don't know this, that they should be getting the purple, they should be prescribing the purple pill to you instead of the blue pill. And when you learn that it is not a fair fight, and it is unbelievably difficult to get to people to understand how do you avoid unnecessary surgery and drugs. I didn't say avoid surgery and drugs, unnecessary. I always believe if it's possible, try the natural way first. And sometimes that's not enough. I will say that some people have waited too long and natural healing is not going to do it. So yeah, okay, thank God there's drugs and surgery. But the truth of the matter is that money talks and everything else doesn't in many cases. And I'm just happy, if it's a revelation, I'm praying that this Robert F. Kennedy Jr. is going to make a difference and get the focus away from the wrong stuff and maybe control the food. The food industry has been out of control. And of course, the pharmaceutical industry is totally out. If I told you what the budget for your average pharmaceutical rep to convince these medical doctors to buy their drugs instead of another drug, it's almost unlimited. So they are not, a pharmaceutical rep is not allowed to present a gift. They can't even give you a card that has got golden raised writing. They can't give you a pen, but they can bring you food and they can take you to dinner. And those dinners are always unbelievably expensive with unbelievable high-end alcohol. And that's what we're going up against. Convincing these doctors that it's this drug that's the right way. Believe me, natural healing organizations don't have that. There's never been a fair fight. And all I'm saying is that if you haven't tried it, you want to get the highest quality, full body red light bed and try it for 6 visits. And if you don't see any change, okay, well, at least you gave it a try. I would doubt that you won't see any change. But interesting enough, the worse off you are, the more dramatic the change typically is. And if you're very healthy and you get into bed, I don't know if you're going to see a difference. You might not. But the worse off you are, the more dramatic the change could conceivably be. I don't know if I've answered your question.
Well, you have, Doc, and I couldn't agree more with everything that you shared. And I hope our listeners take this serious, because there's Jay Kordich, right? The father of juicing, right? The juice man, passed away at 95, I think he was, when he passed away a couple years back. But Jay used to have a great expression, right? You have a choice, sickness or health. And you've laid that out. This is a choice again. You don't have to do this. You don't have to go to a chiropractor. You don't have to eat. You can live on the fast food and the cigarettes and the beer. But 60, if you're done, that's on you. It's not on the rest of society. There's plenty of great options, and you've laid that out very well, Doc. So I want to thank you not only for your time, but also for your commitment, because this has not been easy. And this is, as you said, it's a fight. Anything that the medical establishment doesn't come up with, or big pharma, is always a fight. So thank you for fighting both those fights, for red light therapy and also for the chiropractic profession for all these years.
Yeah. Anyhow, I don't know if I'm going to say thank you for saying that, or let's not announce it too loud.
Don't worry.
Too much trouble here.
My listeners are pretty holistic, so we don't need to worry about it. I don't think we need to worry about it. You never know. You never know. Thanks so much, Doc. Appreciate it.
It's been a pleasure.
Thanks.
Thank you for tuning in. Be sure to check back weekly for more exciting episodes. And don't miss Ink and Insight every Wednesday, where we celebrate iconic authors and dive into their impactful works.